duplication in distribution when you're finally taking care of, all the resources that's arriving in Haiti? Thank you.
Yeah, that's a great question, and that's the major underlying driver in all our work, how to most effectively coordinate this response. And that's our plea to our donors and our partners. We are convening regular, hourly conference calls that are global, regional, and at the country level. Our director convened a teleconference call yesterday afternoon with all our member states from Chile and Argentina and the tip of South America to the north. And we received an update of everybody's activities, and we were able to provide recommendations at this level. And certainly the ground coordination is important too, but again, the communication is a huge challenge. So the bottom line is we're doing the best we can with a very difficult situation.
John, we have a question from Maggie Fox, the health correspondent at Reuters News, who asks, what are the immediate health risks to people in Haiti from things like crush injuries that are typically seen in earthquake situations?
The crush injury is it can be life-threatening because if it involves a limb with a major artery and the person bleeds, loss of blood will obviously lead to their demise. But the injury itself, the injury to the cells and the tissue, not only has immediate consequences, but has consequences down the line when the products, as the body responds to the injury, products are released into the bloodstream that can, in the case of muscle, damage the kidneys. And when kidneys are damaged, this is a vital organ in our metabolism, maintenance of our water and electrolytes. That could also pose a very life-threatening situation. So it's a complicated issue that requires immediate attention. In some cases, patients with these kinds of crush injuries require dialysis. So it even gets more complicated and more sophisticated in the response.
Okay, thanks. And Maggie Fox has another question about the dead bodies myth. Could you explain in more detail about the myth of dead bodies and causes of disease?
Yes, there's the public health issue of dead bodies is important to understand that they in themselves are not a significant risk for creating an outbreak or an epidemic, for example. We have time to manage them respectfully. We have time to manage them so that families can follow up on their loved ones, can receive a sense of closure. There are those issues of respect, cultural issues, individual issues that require that we ensure the maintenance of the bodies are there for all the necessary follow-up. The idea that they need to be immediately collected and put in mass graves to prevent epidemics is really not grounded on all our experience in the management of these kinds of disasters. So we can implement the right technical recommendations and strategies that will ensure families ultimately in the weeks to come have some sense of closure. There's going to be a tremendous psychological consequence to this catastrophe, and we need to manage it beginning at the start.
Okay, thanks. We have a question from Rob Stein of the Washington Post, who's been covering this story, who wants to know, in general terms, about water. How much of a problem is water in Haiti right now, and what's being done about it?
We know that there have been plane loads of water sent to Haiti. There's also the tarmac route that I mentioned. Water is being distributed, coming into the country and subsequently distributed. This is a critical element of the response because once water supply is disrupted or contaminated, this could complicate the situation with diarrheal diseases and outbreaks. So the water is top on our list and being addressed.
Okay. We have another question from Paraguay in which you talk about self-sufficiency. People who arrive to help should be self-sufficient. Does that refer to just having all the supplies and medicaments that they need for providing medical attention, or does it also mean that they need to provide their own food and water to be able to stay in the place?
It's more the latter. You can imagine a situation with the devastation on the ground where people are looking for water and food, the people we're trying to serve. And if you as an outsider come in to provide medical support, for example, request transport that otherwise could be used to be supporting the population that suffered this, or you're asking for food, or you're asking for medicine, you're asking for a change of clothes, whatever, you really need to be self-sufficient. And it goes to having a sleeping bag. There may not be, as far as we know, there are only a few hotels that have any room. Most people are sleeping in the streets. So you really have to think of this as being self-sufficient. Otherwise, you impose a stress on the conditions that are already under huge constraints to help the people that need the help.
Okay, thanks. We have another question from Doris Comorra of El Universal in Mexico, who says she wonders how long it will take the United Nations to take all the bodies off the streets, and what will happen now with 3 days later with these bodies in the streets?
That's a difficult question, and I wouldn't pose a guess even. It's going to be work that needs to be done over the next days and weeks. It'll take a long, long time.
Okay, do we have any other questions from the room? I don't want to monopolize this. Okay, we've gotten several questions about the death toll in Haiti, actually. The Agence France-Presse correspondent Jordi Zamora is asking, do we have, or are we working with any official figures on the number of dead or injured, or are we just working with estimates from the Red Cross and the government?
As we speak, we're working on the information we're receiving from the government, and you cited Red Cross. I think it would be a mistake for us at the moment to really try to put any accuracy. We just don't have the information. We should admit what we know and what we don't know. And in this case, we really don't know. And it's going to take a few more days to get a better handle on the situation.
Okay. And then we have one more question about how can people who have special skills or critical skills identify themselves and offer help to PAHO or to other agencies working there? Do we need people with fluency in French, field logistics, operations? What should people do?
There's been a tremendous offer. We're receiving emails and phone calls. We have a way to collect that information by the Emergency Operating Center. They're keeping a list. But there are some basic requirements in addition to being able to arrive either in a group or with some sort of agency rather than as an individual, that you be self-sufficient. In addition, experience in Haiti is invaluable. Haiti is a country in the absence of this earthquake, difficult, challenging country to work with, so to work in, and if you've never been there before, you may not be able to function as well as where you're functioning at the moment. So I think experience is important, being able to speak the language. French is good, but many people speak Creole, and so that an understanding of Creole may be important depending on where you're based. Being able to withstand hardships. If you've never been in a situation like this, you've never worked in a developing country and without cover, without a mosquito net, without the benefit of blankets and a mattress, you really shouldn't be overwhelming us with kinds of requests that might perhaps be on the side of being naive. We appreciate everybody's emotional response to help, but we really need to be practical and think through exactly the type of person that would be qualified to go there and be most efficiently used. There's a huge amount of skills out there, and we're looking to coordinate that effectively by maintaining this list of expertise. We will be in touch with those who do qualify as this evolves.
Okay, and that person has a follow-up question then. What can people really do to help? What other ways can people help? What are we recommending that they send supplies or materials? Are we recommending donations, or how can people help?
That's a great question because on one hand, if we think about living in the United States and perhaps it's Christmas time and you think about donating food to families that in need, that's excellent. That's wonderful. But that does not help in this case. What we really need are funds, funds that will help with the immediate response, but that also can bridge to the reconstruction of Haiti for the future. And in particular, reconstructing hospitals that are safe and can withstand such a stress, such a shock, so they can be there to serve the population. So I think that as an individual, there on our website, www.PAHO.org, there's an opportunity to link with the PAHF, the Pan American Health and Education Foundation. There are opportunities to link to other NGOs, other organizations that are working in this area, Red Cross and other foundations. So there are many opportunities, and we encourage individuals to respond in CAS as such.
Thanks. And then we have a question from Andrea Downer of Panos, Caribbean in Jamaica, who says that we were told during training to coordinate our communication response and strategy with government structures on the ground and to play a supporting role. Since Haiti doesn't seem to have a structured government now, and the structure was weak before, how do we approach working with the media, etc., on the ground to feed to outside Haiti? What would be our main initial priorities going in as response personnel and as communications personnel?
It's a great question, and I think one of our roles, the Pan American Health Organization, is that it is an organization of countries. It is an organization of Haiti. It is an organization of the United States, of Argentina, of all the countries of the hemisphere. So when in the absence of an earthquake, our secretariat works on the team on the ground, with the team on the ground, on public health issues. So we're there to serve, and we can be the coordinating agency and support in the absence of government infrastructure. So that would be my main recommendation. The communication on the ground there is quite difficult. And so as we get that up and running, I think things will work more efficiently. In the best of situations, a response like this should be done by the government. There's no question, and we as PAHO support the government. But in this case, it's an extraordinary outlier, and will require our role to be, and our partners to be in the lead for the moment.
Okay, and then Rob Stein said he missed what you said right after you gave the estimates that we've heard of the death toll of 50,000 to 100,000, and what that was based on. Was that based on the estimates that we've heard from
Those are
other
estimates that we've heard from other groups, including the government, the Prime Minister, and agencies such as Red Cross. As an epidemiologist, as a scientist, I would hesitate to throw out a number. I've thrown out a range that we've heard, 50 to 100,000, in conditions where in the first 2 days, teams were told not to travel. So we couldn't even collect information. And it's just a huge guess. And I just want to be clear that we really don't know. I wouldn't venture a guess.
And then I understand we have a question from Jamaica via Illuminate. Go ahead, Jamaica.
Hi, good morning, everyone.
Good morning.
Good morning.
Okay.
Go ahead, we hear you.
All right. Hello?
Yes, go ahead.
Is that Dr. Bell?
Okay, great. Panos Caribbean, the organization that I work with, has an office in Haiti and has had a presence there for the past 25 years. We lost our officer staff so far except one, and our staff complement is of about 8 are okay. They're native French speakers. They've been working with the media to develop advocacy tools for vulnerable groups in Haiti. And I know of Jamaica. Internews, an international news agency that has a lot of experience and expertise in operating on the ground in disaster to send out information, has indicated to us just yesterday that they're willing to work with Panos Caribbean for us to coordinate our communication team that we have been working with around the region to take international conferences and to specialize reporting on different development issues, to go into Haiti, and I have been designated to lead that team. I am anticipating that I should be in Haiti with Panos and interviews by the weekend. My executive director who works out of Jamaica is in Washington now at our head office. He flew yesterday, and he's expected to be in Haiti if he can get a flight in by Sunday. He'll be there for a week, assessing things on the ground, sending out information. There was a mention just now of challenges maybe with getting information out. Internet that is on their website has operated in the 2004 tsunami, and they use portable equipment that could move. And so they are prepared and ready to send out news on the ground. They're self-sufficient, and they already have a team that doing reconnaissance. However, I haven't gotten any updates from them. So that is my contribution. That is kind of Caribbean's contribution, because we are on the ground and we will be going in independent of PAHO if I am not assigned. And I already communicated that to the speaker. Thank you.
Yes, thank you very much. And I'd like to commend Haiti for the support you've given with sending medical teams via your Red Cross Coast Guard ships. You're accepting patients. It's outstanding. Dan, do you have her email there? Do you have the contact information that we can follow up on the information she requested?
I don't, but we will get in touch with her.
Excellent.
With panels in the Caribbean through our Jamaica PWR office.
And thanks again to colleagues in Jamaica.
Do we have any other questions from inside the room? Please go ahead.
Do you fear any spread of any infectious disease looking at the situation? Open sewers, no sanitation, poor sanitation?
That is a potential risk. It's a particularly in this condition. In most disasters, one myth is that the disaster causes outbreaks or plagues. That's not the case in most disasters. But what we're talking about here in Haiti, where there's such devastation, and going into this event, we already knew that coverage levels, it's been very challenging, for example, in the childhood immunization program, to achieve the same level of coverage that other countries. So you have pockets of children that are not protected to some of the traditional major killers in the past that we've been able to prevent with vaccines, like diphtheria, measles. Our experience in refugee camps, for example, measles outbreaks can occur. We need to be on the guard for that. And so one of the strategies identified by our risk assessment is the need to provide vaccines. There will be down the line mass vaccination campaigns to prevent those vaccine preventable diseases. When water, you mentioned specifically water, diarrhea outbreaks could pose a huge problem. So that's why water is such a priority. So, if you look at just childhood mortality in developing countries of the world, it's diarrhea and acute respiratory disease in the absence of a crisis are the major killers. So with this crisis, we want to stay focused on those for our vulnerable populations, and children are included in vulnerable populations. In the adults, with such traumatic injuries, tetanus is always a concern, and I'm sure that the tetanus coverage levels are low in Haiti. We require a booster dose every 10 years to prevent tetanus due to contaminated wounds, and that's going to be also a challenge.
Any other questions from inside the room? I think we've answered all the questions sent in electronically. So anyone else here? Yeah, we do have one on mental health. If we could say in general about mental health concerns that we might have for survivors and responses.
This is a huge concern. It's often overlooked in some disaster responses, but it's something we need to be attentive to. The management of dead bodies is one aspect of the grieving process that if we do it right, we can mitigate some of the risks of mental despair. There are a number of issues related, but yes, and as things start to settle down a little bit, we will need to recruit experts to provide those kinds of services. If we overlook that, then it just creates more despair, more contributes to the situation that is already difficult to manage.